Valier. How are you feeling today?
I'm good.
My name is Kenzie. I'm going to be your student nurse today, and we're just going to be doing a head-to-toe assessment. Is that okay?
Mm-hmm.
All right. So first, I'm going to ask your name and date of birth.
March 3rd, 1999, Shaylee Valier.
All right. Do you know where you are?
My friend Lily and Mike's house.
Okay. And do you know what the date is?
Today is December 7th, 2019.
Okay. So my patient is alert and oriented times 3, which is good. So I'm going to give you 3 words to remember, and at the end of the exam, I'll ask you to say them back to me.
Okay.
Okay. Beach,
Beach,
car,
car,
and sleep.
sleep.
Okay.
Yeah, beach, car, sleep. Okay.
Awesome. All right. So the first thing I'm going to do is actually inspect your head and all of the things going on up there. So if you could sit up for me, that would actually make it easier.
Yep.
Thank you. Okay. So first, I'm just going to inspect your scalp and palpate from the front to the back. And it looks good. I don't see any critters or anything to be concerned about. Skin's not dry. Alright. So that's good. Alright, so now I'm just going to do a test on your eye with this light. Okay, so just focus on me for this one, okay?
Okay.
Okay, and now for the next one, I'm just going to use this marker.
Okay.
And if you could focus on the marker as I move it closer to your face. Okay, perfect. And now just follow the marker with your eyes only. Okay, perfect. Looks good. And now what I'm going to do is a peripheral vision test. So if you could cover this eye with this hand, and I will cover the same, and we should see it at the same time. So when you see it coming, tell me.
Okay. I see it.
Okay, perfect. All right. So now what we're going to do is look at your ears. I'm just going to palpate them. You have piercings, but they don't seem to be inflamed or irritated. So that's good. And now I'm going to do a whisper test, which means I'm just going to put my hand over this ear and whisper something in it, and you have to tell me what I said.
Okay. Snow.
Okay, perfect. Okay, so everything with the ears looks good. Now I'm just going to look at your nose a little. I'm not going to go into depth, but looks good. Nothing going on there. If you could say ah and stick out your tongue. All right, upon inspection, it looks good. Okay, just gonna palpate your sinuses. No pain when I do this?
Mm-mm.
Okay. Feel for your lymph nodes. And no pain when I do any of that either?
Nope.
Okay, well none of them are inflamed or enlarged, so that looks good. Now I'm just going to look for your thyroid, so if you could swallow when I tell you to. Okay, swallow. Okay, feels good. Alright, so now I will have you turn around, if you can, please. And I'll be listening to your lung sounds and doing some chest expansion exercises. So I'm going to put my hands on your back, and when I do that, just take a deep breath in. Okay. Okay, so my hands moved evenly each time I did that, so the chest expansion is good. So now I'm going to listen to your lung sounds from the back, so every time I put my stethoscope on your back, just take a deep breath in. Okay, sounds good. So now you can lay back down. I'm just going to listen to your heart and lung sounds from the front.
Okay.
So I'll start with the lungs just because that's what I was doing. And see that they sound the same. Okay, everything sounds good, so now I'm going to listen to your heart sounds. Alright, that sounds good. No murmurs or gallops. Alright, so now I'm going to check your radial pulses. They are regular rate and rhythm and +2. I'm just going to check your cap refill. I'm going to do it on this side because you have nail polish on. Okay, less than 3, so that's good. Okay, while I have your arms out, I'm just going to inspect your skin on your arms. No lesions, all smooth. I'll just check your legs too. Okay. Looks good. I'm just going to take your socks off to check the pulses down here. Okay, so those are good. Now I'm just going to lift up your shirt if that's okay and inspect your abdomen.
Yep.
Okay. You have a belly button piercing, but it doesn't look to be any sort of infected. It's not inflamed or irritated. It doesn't cause you any pain ever. Okay. So upon inspection, I don't see any signs of ascites or anything that would cause me concern. It looks good, so I'm just going to take a listen to make sure you have bowel sounds. Okay, bowel sounds present in all 4 quadrants. So now I'm just going to palpate and make sure that you don't have any tenderness or pain, okay? So if it ever hurts, let me know. No pain. Okay, I'm not feeling any tenderness, so that's good. Okay, perfect. So now if I could have you stand up, I'm just going to take a look at your back. Do you have a history of scoliosis or anything like that?
No.
Okay, so if you could bend at the waist, and I'm just going to feel your back all the way down, or feel your spine rather. Okay, perfect. So I don't feel any deviations, so that's good. You can sit back down, but just stay sitting upright. We're going to do some range of motion, so can you move your neck like this? And up and down. Perfect. And can you raise your arms? Yep. And all the way down. Arm circles with one arm at a time. Okay, awesome. And can you lift your legs up? And no pain when you do that. Okay, so can you push down like you're driving a car? Lift up. Okay, and then push up and push down. Awesome. And if you give me your arms, you push against me and pull towards you. Okay. Perfect. So that looks good, I think. covered everything I wanted to do with you today. So do you have any questions for me?
No.
All right. Perfect. And you're not in any pain or you need any water?
Nope.
Okay. So before I go, can you repeat those 3 words that I said at the beginning?
Beach car sleep.
Perfect. Awesome. All right. Okay. If you need anything, let me know. Here's your call bell.
Thank you.
I'll lift the bed rail up.
All
All right. I'll see you later.
Thank you.